hard to prioritize you because you are in high risk, and there's a need for...
In a bid to fight against viral hepatitis in Lagos State, stakeholders and Viral Hepatitis Control Program partners in Lagos united to strategize on a comprehensive and collaborative approach to curb the menace of viral hepatitis in the state. During a crucial stakeholders meeting on viral hepatitis control at the staff clinic Alausa Ikeja, the Lagos State Ministry of Health, through the coordinator of the state Viral Hepatitis Control Program, brought together key players in the fight against the disease. Speaking at the event, the permanent secretary of the Lagos State Ministry of Health, Dr. Olusegun Ogboye, urged all residents to prioritize testing for viral hepatitis and commence vaccination if found negative. He emphasized that testing is the first step towards preventing the spread of the disease.
We will know where we can get access to treatment for it, what tests they need to get done regularly so they can be picked up very early. And so we bring stakeholders together, want to educate each other, and then also to plan on the best way to plan for prevention of hepatitis in Lagos. I think the first call is to get tested so you can get vaccinated. I think that is what we will be asking of everyone, because that is the entry point into prevention and is the entry point into care.
Similarly, the State Viral Hepatitis Control Program Coordinator, Dr. Mazidat Enriosho, echoed the call for testing and vaccination for residents.
People could actually, we are imploring Lagosians to please get to know their status. And how would they assess this care? If they get to any of our general hospitals and even our primary healthcare centers that they want to get tested to know their status, and any individual that is negative is eligible to be vaccinated, and they should ensure that it's a 3-dose vaccination. You get your start dose as at the time you are screened if you are negative, you get your second dose 4 weeks after, and your third dose is 6 months after. For the positive individuals, we have centers in Lagos State where we have the specialists. We call them the gastroenterologists. In LASU, Lagos State University Teaching Hospital, we have the gastroenterologist. In General Hospital Ifakojayi, in General Hospital Lagos, as well as General Hospital Isolo. And for the federal facilities, we have Lagos State University Teaching Hospital, LUT, as well as NIMA. So the essence basically for this meeting is to bring all stakeholders that are working in the viral hepatitis space to see how we can charge a way forward in curbing the menace of viral hepatitis in Lagos State.
By the time a person who has hepatitis B has symptoms, many times it's already too late. Either the person already has liver cirrhosis, in which there's massive damage to almost all parts of the liver, or the person goes into liver failure, or the person has liver cancer. Otherwise, in the early stages of infection, the person does not know because he has no symptoms at all. So the way you can avoid the infection, or one of the ways you can avoid the infection, one of the ways you can protect yourself against getting the infection is by vaccinating. The vaccine has been available in Nigeria since about 2004, and it's actually quite effective, about 96% effective at protecting against hepatitis B infection.
It's key to enhancing the advocacy and awareness when it comes to hepatitis B. As I mentioned in the last meeting that I came, that I really do not know anything much about hepatitis before now, but this engagement in the past few weeks has enlightened me and showed me that there is more than we know. The liver diseases, I'm sure nobody wants to be diagnosed with liver diseases. I've seen someone that has critical liver condition. It was a very critical case. The person almost committed suicide because she was tired of life. That's basically it. So you wouldn't want to get to that stage.
Access 24's correspondent Daniel Tanimu reports that the stakeholders at the meeting agreed that sustained engagement, awareness campaigns, and continuous testing and vaccination drives would be central to Lagos State's strategy.